Good morning. Welcome to the Groveland Council on Aging. My name is Lynn Stanton. I'm the director here at the Groveland Council on Aging. I am a certified Shine counselor. That occurred about a year and a half ago. So I will be doing the presentation this morning on Medicare 2015. Our beloved Shine director for our region retired in July, and she always does this program, and she was wonderful. She was just a wealth of information, knew everything about everything, and could answer right off the top of her head without referring to any manuals and so on. I sadly do not have that vast knowledge yet, but I'm working on it. I wanted to give you a little bit of information about events and programs happening very shortly. Tomorrow, Wednesday, October 22nd, from 10 a.m. to 12, we'll be doing hearing screenings with mass audiology. That's going to be in the outreach office. You do need an appointment to come in. They're just a quick 15-minute appointments, but it might be either A, reassuring that your hearing is just fine, or B, help you gain a little more information about some aids to help you hear better. Coming flu clinics, we've got one for folks 60 and over. We have one on Tuesday, October 28th, essentially a week from today, right in this room from 10 a.m. to 12 p.m. Our Board of Health nurse, Anita Wright, will be conducting the flu clinics as usual. She's also a member of the Council on Aging Board, so she's a great advocate for all of us. So she will be here doing flu clinics on the 28th, and then 2 days later on Thursday, October 30th, she'll be doing clinics for 60 and over again in this room from 3 to 5 p.m. Correct. And then on Tuesday, November 4th, it's state elections. Come into Town Hall, we vote right here, vote early, vote often, and that will be from 7 a.m. to 8 p.m. So, welcome. Are there any new Medicare beneficiaries in the room? If so, raise your hand. No? Okay, then that means we can zip through this a little. Yes, ma'am?
I'm not a Medicare beneficiary. Am I not?
No, but this will be good information for you, just to begin, because it is complex and I know it's incredibly confusing. But I will have more information for you specifically if you want afterward,
Okay.
and that's a help. So again, it's a complex issue. We try to keep it simple. I'd asked each of you as you came in, just grab some of the literature up front, because they're documents provided by the Shine program that give a great summary of everything involved. So we'll start first of all with changes for 2015. Your Medicare coverage under Part A, that stays the same, except if you look on your green sheet, if you have straight Medicare and you do not have a supplement, that's what the green sheet is all about. It's telling you in a short form what's covered and what's not. Straight Medicare was never intended to cover all of your health insurance or your health needs. It only covers 80%. You're required to pay the balance, which is 20%. And there are some amounts that you have to pay for first, and those are listed on the green sheet. The change for 2015 is that your hospital deductible under Part A, and Part A covers your hospitalizations and skilled nursing facilities, for instance, nursing homes and rehab, home health care, durable medical equipment like walkers, wheelchairs can be under that category, and hospice care. That deductible that you have to pay if you have no supplement has gone up to $1,260. That is for your first 60 days within hospitalization. Okay, so that's a huge chunk of money, which is why everyone generally obtains a supplement, either a Supplement 1 or Core or a Medicare Advantage plan. That fills in, they're also called Medigaps, that fills in the gap between what Medicare pays and what you're going to be charged. So do know that without a supplement, you're going to get whacked with that huge amount of money. And that can occur every 60 days that you are not in the hospital. So if you're released from the hospital tomorrow You go 60 days without any other event that puts you in the hospital. At the end of that time period, 5 days after that 60 days, God forbid you fall down and, break a leg. And you're hospitalized, you will be charged that deductible again. That's why we have supplements. And I'll talk about those in just a moment. The Part B coverage, which is your physician provider coverage, that also has a deductible under straight Medicare. That's $147. That hasn't changed from last year. So that has remained the same. An item that you should be aware of with regard to hospitalization is we have this new difficult situation wherein you're at the hospital, you've had some sort of event, perhaps a heart problem, breathing issue, you go to the emergency room, you end up spending the night, you're in a bed, and you think that you've been admitted to the hospital. That can be just observation. And say you need to go to a rehab facility after that. If you have not been in that hospital under admittance status for 3 consecutive midnights, your health insurance will not pay for that rehab, even though you need it. So you want to be very sure that you ask your physician and ask those attending you to let you know whether you are being admitted or whether you have been admitted or whether you're just being observed. Because they can do that. It's a situation where they're not really sure what's going on, you need some tests. You want to be sure you know one way or the other, particularly if you've slept over, and particularly if they want to send you to rehab. You can fight it, you can argue, but you want to make sure you inquire. It's important. And if you can't because you're not awake, you would be wise to talk to your friends and family who would help you in such a situation and let them know that they need to inquire. And I have that pink sheet sort of tells you about more of what you need to know about that. Another non-change is the cost for your Medicare B premium. That has stayed the same this year. It's going to remain at $104.90 for 2015. Medicare A you receive for free. You've paid taxes, you've paid into it. Medicare B does necessitate a premium. You do have to pay that if you want physician coverage. And that's usually taken out of your Social Security check. If you do not receive Social Security and you have some sort of other pension or other retirement plan, they will bill you. They can bill you quarterly, however that goes. But that has stayed the same this year, that $104.90. And the white sheet sort of summarizes that situation. If you are of higher income, for instance, married with a joint tax return and your income is in excess of $170,000, as a retiree yet under $214, woo-woo, wish it were me.
Me too.
It would be $146.90 for your Part B premium. So just to be aware of that if anybody falls in that category. All right. The next item. The blue sheet, if you would grab that. Want a blue sheet, Rose? That's because that kind of doesn't apply to you in particular.
Right, thank you.
That's all right. The blue sheet talks basically about 2 sorts of supplements. And on the vertical side, it's going to list the benefit under Part A, B, skilled nursing, etc. The cost for beneficiaries with just original Medicare, to give you an idea of where these fit in. The costs for a supplement core, and most people are not aware of that, and most of the insurance companies in our area, the northeast of Mass, have a core available. It's essentially a lower cost version of a supplement. And then to the far right column is supplement 1. So just to give you an example, original Medicare, should you be hospitalized, requires you to pay a $1,260 deductible if you're in the hospital days 1 through 60. If you have a core plan, you will also have to pay that $1,260. If you have a supplement 1, you pay 0. Your insurance supplement will cover that hospital deductible. If you go down the next line, so you can see here, should you, bless you, God forbid, be hospitalized for days 61 through 90, original Medicare will charge you $315 a day. If you have the core plan, it will pay 0. If you have supplement 1, it will pay 0. So just realize that core is going to have you paying a deductible. You just need to know how much. And some folks, depending on their health situation, they might be on the younger end of the Medicare availability spectrum, say in the 65-year range, might be in very good health, have no issues, and a core would be sufficient for their needs. For those whose health is a little more precarious, perhaps a little more frail, a supplement 1 is going to work for you because it's going to pay everything. Even though you pay a higher premium up front each month, you're going to have no costs should a health issue emerge. Flip it over, if you will, and this is the summary of the plans that are available in our geographic location. Just a caveat, please be very wary of listening to what your friends in New Hampshire or the Berkshires or Nantucket or Maine, be careful what they tell you. Every area is different. The insurance options are quite different. The general green sheet Medicare deductibles and copays, that's the same. That's the federal part of it. But the supplement part really varies very much from area to area. You know, I have a sister in New Hampshire. Her options are completely different from this. Completely different. So you want to be careful about that. So for instance, we'll just take the middle one, Harvard Pilgrim. The supplement core monthly premium is $105. That's going to supplement A and B. It does not offer a dental and vision benefit, but it does include foreign travel. Also be aware, if you go to Canada or the Caribbean, it's still considered foreign travel these days, Medicare covers nothing. Many insurance plans cover nothing.
On the core?
Pardon me?
On the core?
In core, no. Core does, for instance, for Harvard Pilgrim, yes, they do cover it. Fallon does not cover foreign travel. So you want to be aware of that when you're making a selection. Do you have friends or family in Canada? Do you enjoy a trip to the Caribbean periodically? It's all based on your particular life and what you enjoy doing and where you're going to be going. Just be aware that not all supplements cover foreign travel, and Medicare does not at all. Okay? And then if you go to the next column, again, Harvard Pilgrim, kind of in the middle, the supplement 1. Yes, sir.
Oh, Lynn, I'm with Physicians Life and Casualty for my Medigap.
Okay, so that's a retiree plan then, no doubt. Through a former employer?
No, I picked it up when I moved to New Hampshire from Massachusetts several years ago.
And you and I will talk after this program, because it's particular to you. Okay, we'll talk afterward. So supplement 1 has a $199, yes ma'am.
Well, that was exactly what I was gonna ask, except that it is from a former employer, so.
Okay.
That not everything's here if you have.
That's
it.
correct.
Okay.
If your company, when you chose to retire, offers a retiree plan, those are not here. Those are particular to your own company. They're not available to the rest of the population. Our program today is for everyone. Not particularly those who have retiree plans. For instance, I work for the town of Groveland. We're part of the GIC. That's not a plan that's available to everybody else. It's a retiree plan based on my former, still, God willing, employment. So yours is a retiree plan special to your former, either
It was not a
location where
retire-
you lived, which would be New Hampshire, or the lady behind you, your employer. But I can talk to you after about that, because that does not apply to everyone here, and that's what this program is about. But we can talk about that afterward. So anywho, back at the ranch, they too do not offer dental or hearing or vision. It does include foreign travel and a fitness weight loss benefit. Some do, some don't. So look at these and see where your preferences lie. So this is a supplement, either core or supplement 1 to Medicare A and B. Then we have the ever confusing and really tricky for some folks, but it doesn't have to be, Medicare D. You have, so you choose a supplement. Supplement 1 or core supplement. You still have to choose a Medicare drug plan. You don't have to, but for every month that you do not sign up for a Medicare drug plan, and you do not, you're penalized 1% for each month that you didn't sign up when you were eligible to, barring a special enrollment period. We'll talk about that later for those who are interested. So that 1% per month, say you didn't sign up for a year. That's 12%, which will be tagged on to whatever plan you choose when you do enroll. Say your health situation changes, whatever plan you choose when you do enroll, that will be tagged onto that premium that you pay. Say it's $30 a month. So it's going to be tagged onto that for the rest of your life.
Wow.
Likewise, be aware, Part B that has that $104.90 premium, if you do not sign up for that when you're eligible, you will be penalized 10% for every 12-month period that you didn't sign up when you were eligible. So say to make the math easy, the Part B premium were $100. You will be charged $110 this year, and then it goes up. Next year it goes up to $115. You're going to be charged 10% on top of that $115 that year for the rest of your life. So it is important, I think, to be aware of that. Life is a gamble. You can choose to do what you want to do. I know a little lady who did not sign up for Medicare B until she was 80, and she now pays about $188 a month for her Part B premium, when all of you are only paying $104.90. So just be aware of that. The same will hold true for the prescription drug piece. So, Charlie.
On the prescription drug piece, once you sign up for it, do you have to, quote, renew it every year?
If you want, and we'll get to that, Charlie.
Okay, fine.
So the prescription drug piece, which is relatively new in the grand scheme of Medicare, that came about during President Bush's administration, George W., about 2006. It's actually a wonderful benefit. There are some problems with it that are gradually, through the Affordable Care Act, actually, are being remedied over the course of time. So I have a white sheet that you all had an opportunity to grab. That's essentially a cheat sheet for Medicare D. These are the drug plans in our neck of the woods, offered by the various insurance companies. It's kind of small. Please do put your reading glasses on. It says at the top, 2015 Massachusetts standalone Medicare drug plans, and it summarizes to the left which insurer it is. This has changed a little, and these change every year, so you really want to stay on top of the information you receive from your drug plans as well as from your supplements to A and B. The Part D insurers change each year as well. Drugs go in and out of tiers. New drugs are added to the formulary. Those are important things to keep in mind. And it usually goes something like this. The lower the monthly premium for your drug plan generally matches up with a $320 possible deductible. Some of the drug plans you can choose have a $320 deductible where they do not start paying until you've paid for the first $320. That's up $10 from last year. When they're a little higher, as a general rule, the monthly premium, that'll give you a 0 deductible. The plan will start paying immediately. It's a matter, again, like the supplements, of what you're comfortable with. What's your tolerance for risk, really? Keep in mind, with all of these, you can change each year. You're currently in the open enrollment period for Medicare D. In Massachusetts, as far as the Medigaps go, the blue sheet you had, it's open enrollment year-round. That is different from other states, just so you know that. So, for instance, with the Ds, please see me if you have a list of medications that you would like to have assessed. I do it through the Medicare.gov website. Any of you can do it if you're comfortable on your computers at home. Anybody can do it at home. You key in without having to give them, you can go in as a guest, without having to give them your name, your Medicare number, your Social Security, current insurance plan. You don't have to give any of that. You go in as a guest. You key in your medication, the dosage, how often you take it, what your preferred pharmacy is. You know, that makes a difference as well. Some folks don't want to go anywhere but Walgreens. That will affect which Part D plan you choose, mostly because it will determine how much you pay.
What was the website?
It's Medicare.gov, G-O-V, and that has a wealth of information for, especially for folks new to Medicare. Pretty much everything you need to know is on that website. So just be aware of that, because it's a huge help. But if somebody's not comfortable, just see me, and I'm happy to key that in for you within the next week or so. Open enrollment is from October 15th to December 7th, Pearl Harbor Day. If you keep that in mind, you want to have your decision made and a phone call made, or logged in online through the insurance company, if that's your preference, by those dates. And you can do this every year. If midstream next year your physical situation changes and your medications change, you'll have this time to make that change. You know, yes, ma'am.
I just wanted to share one bit of information someone told me about the core plan and the supplement one. If you sign up for the core, I don't know if this is true this year, but I think it might be. In Massachusetts, if you sign up for core and you find out you're going to have surgery and you're going to have to stay in overnight,
You're absolutely right.
you can upgrade your plan during the middle of the year, and that next month it will go into effect at the higher level. So if you're on the fence with whether to sign up with core or MedX, with
Supplement
core
one.
or supplement one, that's another possibility.
That's
you could-
absolutely correct. Particularly, it's not going to help you if you have, God forbid, a heart attack.
Right.
Or you get hit by a truck. But if you need a knee replacement, and that's something that can be planned in advance, the insurance companies allow you to bump from the core, which is a lower priced and, you know, less advantageous plan, to the supplement one. That, you're absolutely right. It's kind of a nice little benefit. They don't really talk about it that much, but you can do that.
Yeah.
Here's another thing for Medicare D in the same vein. See, everybody helps me as well as my opportunities to help you. Everybody's got experiences that they've encountered that help you go forward and that we can share with each other. Medicare D has the open enrollment now. we have in Massachusetts, as do some other states, a state pharmacy assistance program. In Massachusetts, that program is called Prescription Advantage. It is income eligible, no asset requirements. There are various levels of help depending on your income. I have some rate sheets available for you to take home to learn a little bit more about it. But that enables you to change your prescription drug plan off-season, as it were, or off one other additional time mid-year, should your health circumstances change. So, you know, just be aware of that. It doesn't cost anything to apply. Unless your income is on the high side, there is no fee. If it is on the high side, it's $200. It has some wonderful benefits. A, that it will allow you to change plans midstream. And the other benefit is, should you fall into the donut hole, that dreaded, which has just increased this year. So it's a part of that Affordable Care Act where you're dropping into the donut hole, it takes longer. It was like $2,800 and some odd dollars last year worth of costs for your prescription drugs, between the cost your insurance company pays for your medication and you pay. That combined gives you the amount to determine whether you go in the donut hole. Doesn't include your premium, but that amount of money determines going in the donut hole. This year it's $29.60, which is a larger amount. Prescription Advantage helps you should you fall in the donut hole. It helps with the cost of medication. Currently, when you're not in the donut hole and you don't have many medications, it's usually a 75-25 split. You pay 25, the plan, your insurance company pays 75. When you fall in the donut hole, that split changes. Let me just make sure I get it right. It's usually 65-45, depending on the plan you choose. But 65 for generic drugs and 45 for brand name drugs. So Prescription Advantage does help you with those copays in the donut hole. So that's important to know. And this sheet is actually a terrific help in terms of, you know, what you choose. But again, the key is, what do you take for drugs? You don't want to go with your neighbor who says, oh, I have AARP, that's terrific, which is actually United Healthcare. It may be for that particular person, but when you key things into the formulary or the drug finder on the Medicare website, you want to make sure that the company covers all of your drugs. You may have one peculiar one specialty drug. And again, looking at this chart, it will tell you the premium per month. There's an item that says after full LIS. I'll talk about that at the end because there's some opportunities for you to save money depending on your income. Some have a plan deductible that usually has low premium, but that $320 deductible. And then the prescription copays for a 30-day supply retail, 90-day supply by mail. Again, that's an option, especially if you're taking medication sort of on a maintenance basis. It's staying the same. It doesn't change from month to month. So mail order might work for you, and that'll save you some money. But looking at the copay, there's usually like 4 or 5 tiers. First one being preferred generic, then a generic. Then a preferred, based on your insurance company, then a preferred brand name, and then a brand name, and then a specialty drug. Oftentimes those are the quite expensive cancer treatment drugs, other sorts of specialty drugs depending on your particular situation. So you want to be sure that you choose a plan based on your medications, not necessarily your neighbor's. So that is what that's all about.
Excuse me, Lynn.
Yeah.
I don't see Tufts on here, though. As far as Tufts.
Because your plan is different. And I'll talk about that now. Ma'am?
Well, I'm not sure what I'm going to say, because I was told just yesterday that Harvard Pilgrim does not include Plan D in their insurance program, as do other companies, because we live in Essex County.
Here's the thing.
Is that true?
You don't have to go with and this is kind of a popular misconception. You don't have to pick a Blue Cross Blue Shield prescription drug plan to go with your supplement one. These are separate. You can choose whatever you want. So even if Harvard Pilgrim does not have a prescription drug plan, you choose another company.
Right.
You don't have to go with the same company for both items.
But is it cheaper if the insurance company does include Plan D?
Not necessarily,
No.
it just depends on your
No.
medication, not necessarily. I'm gonna talk to you about Medicare Advantage plans next, and that's a whole different thing. And it's kind of interesting and works wonderfully for some folks. But you don't have to have the same at all, and sometimes it's not worthwhile at all, to have the same insurance company for your medications as you do for your supplement. And I think it's part of that thing during your working life. You had one insurance company that covered everything, and it might have covered you as a couple. Yet when you hit 65 and go on Medicare, it's every man for himself. You have one plan, your wife has another plan, and then there are separate plans for their medication. So it becomes like, what is this? But that's Medicare. It's, once you hit 65, there is no longer a family plan or a couple plan. It's, each person is insured. And you don't, as individual, and we're gonna talk about this with the Medicare Advantage plans, that's gonna be the yellow sheet. And this should reduce somewhat the confusion. You don't have to choose the same plan, the same insurance company within the same family. My needs, yes, Charlie?
Before you leave the Part D, once you sign up for that, do you keep having to renew it, or if I signed up for it last year, am I okay?
Good
to
question,
carry on?
Charlie. Should you, and this is true of the supplements, if you decide this is a great plan after I did my homework, and please do your homework, after reviewing the new benefits and so on, you don't have to do anything to stay on your current plan. It's only when you make a change. And that's true of the Medicare D plans as well. You know, if you'd like to stay with the company you currently have, you do nothing. If you want to make a change, you do that, and that automatically drops you from the previous plan. Margaret, you look puzzled.
Well, no, I run into a situation this year. My mail away is supposed to be cheapest. And I was not, feeling too good. So I didn't get involved with the mail away. I went to the local pharmacy. And it was cheaper than the mail away. I mean, it was a good bit cheaper, like $50.
Then stick with that. That'd be my
Well,
plan.
yeah, but I never realized that could happen because the local pharmacy isn't even in the pharmacy list. as
And
a
you would
preferred
pay
pharmacy.
usually a little more if your pharmacy is
Exactly.
not part of the preferred pharmacy.
Exactly, but even, it was a lot less, it was like I say, around $50 less for 3 months supply than my mail away.
That's interesting. That can happen.
So I'm now checking because I found another one that I can get cheaper through the pharmacy
Perfect,
than through the plan mail away.
perfect.
But,
Perfect.
I didn't see it
That's where the difficulty lies. You really do have to read the brochures that come in the mail from your insurance carriers to see what they do and don't cover. And it's kind of worth it, particularly with the high cost of medication, to inquire,
Yeah.
what's going on in terms of cost. Here's something else to consider too. Just lost my train of thought. Sorry, I went offbeat. Oh, if you take nothing, say you're just taking calcium and a multivitamin and you're taking no other medication. The big question is, should you choose a Medicare D plan? Because you're not taking anything. And you say to yourself, well, that's a screaming waste of money. Here's the thing. Again, you don't have to, but you don't you want, so my approach, and I can't really advocate for this because we don't advocate as Shine counselors for any particular drug company. The beauty of the Shine program, wherever you live, is that the counselors do not recommend any particular insurance company. You're gonna get unbiased information. The beauty of that blue sheet. Here's at a glance what's available. I'm not advocating for one company or another. But, that said, if I was making the choice to choose a Medicare D, not wanting to be whacked with that penalty 2 years from now when, say, some health issue arises for me, like diabetes or something, where I'm going to have maintenance medications, I'm going to now, today, when I have no medication, I'm going to choose, just to cover the law, as it were, least expensive plan here. The one with the $300 deductible, $320 deductible, what, I'm looking at the wrong thing, whatever it is, whichever plan. So if you look down your list, who has the least expensive per month
Humana RX.
Humana Walmart RX plan? And be specific, because as you can see, each company has 4 various good, better, best, saver, value, preferred. You want to make sure you get the language right. So in this particular case, I might choose that because it's the least expensive per month. It covers me should some health situation change. Being the frugal woman that I am, I really don't like paying for something that I'm not going to utilize. And I know I'm not going to utilize it. But it's called insurance for a reason. It's your willingness to take a risk. 1% per month of something that's not very expensive, like say you went with $30 a month for the premium for a Medicare D plan, and I decide I'm not going to sign up for it because the penalty will be really small against a premium that's small. It's not like the supplements, which are around 175 up. Some people do that. Some people have done that. The trouble is we don't know in the future, again, insurance, we don't know in the future what these premiums are going to be. So you don't want to have to pay a high premium later on down the pike because, you know, you try to save a few cents now. That's where I'm trying to get over my frugality and be a wise shopper.
Does that go for New Hampshire as well? That's federal?
Medicare D, yes.
Okay.
Yep. The penalty's the same, just like the penalties for not signing up for Part B when you're able. There is, again, a caveat on the medication piece as well as supplements. If you are a veteran, veterans benefits, if you sign up and are enrolled in a veterans program, we have a wonderful veterans agent in Haverhill. His name is Mike Ingham. He's at the Citizen Center. For folks in our neck of the woods, do speak with him. Give him a call. He's here once a month. If you're enrolled in the VA, you can receive your drugs through the VA program. That is considered creditable coverage and means you do not have to sign up for a Medicare D. The only hitch in that would be, say I get strep throat tomorrow. You can't necessarily get to, because that's all mail order, by and large you can't really get to the VA in a quick fashion, so you have to go to the drugstore and pay for that antibiotic yourself over the counter. But it is considered creditable coverage. The other piece of it, if you're still working, you're 65, but you're still working, maybe you're 68 and you're still working. Your insurance coverage through your employer, if your employer is over 20 people, covers you. You don't have to sign up for B. You don't have to choose a Medicare D plan because you're still working and your company covers you. Ma'am.
Within a Plan D program, there are 2 different categories,
Often, sometimes 3.
sometimes 3. Within that year, can you change from one to another?
Only if you're enrolled in Prescription Advantage. Otherwise, the only opportunity to enroll is during the open enrollment period now.
Okay.
Yeah, it's just how it is.
So in other words, you're stuck with whatever you sign up with for an entire year.
Correct. Unless you enroll in Prescription Advantage, and that does give you an additional enrollment period for you to change, sir.
Can you switch between Advantage and the regular?
You can disenroll, and I'm gonna talk about, which is a fabulous segue. We have Medicare C plans. Have you ever heard of that? And said to yourself, what is that? Why does it go A, B, D? Where's the C? Medicare C plans are called Medicare Advantage plans. They're particular. They're generally HMOs or PPOs, HMOs being health maintenance organizations, PPOs being preferred provider organizations when you're in a network. Medicare C is a combination of a supplement to A and B, and that's your yellow sheet. It's a supplement to A and B plus your drug coverage, all for one monthly premium. What happens is Medicare, you still continue paying $104.90 for your premium for Medicare B, but Medicare sends that money to your insurance carrier, and the insurance carrier for Medicare C plans or Medicare Advantage plans takes care of all of your health insurance needs. Just be aware that there are higher out-of-pocket costs for the Medicare C plans. In this situation, you do have both, say for instance you had Tufts. Tufts is further down the list here. Tufts Health Plan. You have several choices here. Keep an eye out to make sure that you choose one that has a drug plan. They have a low monthly premium, but the costs associated with them are higher. When you have a core or supplement one, you pay more upfront each month, but you pay very little, especially for supplement ones, when you go to the doctor, when you go to the hospital, that sort of thing, when you need a blood transfusion, etc. With the Medicare Advantage plans, you have a very low, quite reasonable, as they would say, if you can call bloody health insurance reasonable, a more reasonable monthly cost, but you pay more up front. You pay a copay each time you go to the doctors, to the dermatologist, for your primary care, for your cardiac specialist, for your orthopedic woman. Each time you do that, you're paying everything up, as it goes. So you pay low up front per month, but you're going to pay more. You're going to have, for instance, in some of these plans, you might have a $450 copay per day for visits, for overnights at the hospital from days 1 through 3 or 1 through 5, which is going to exceed the usual $1,200 and some odd dollar deductible. So just be aware, for some folks with no health issues at all, it's a great option. It's inexpensive, it works for you. If you're only going to the doctor twice a year, big deal. You pay $25 copay for your primary care, for instance. But you're not paying a whole lot, during each month for your premium. For instance, if you look at Fallon Senior Plan Super Saver RX, blah, 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 blah. That has it's an HMO, so you have to have a referral to see a specialist. You have to stay within their network. You have a zero monthly premium. Each time you go to the doctor, each time you go for blood work, anytime you go to the ER, you pay a lot. So again, it's insurance. It's taking a gamble. That might work very well for you, but it might not work for you. And that's true in the same household. Your sweetheart might have, and that would be a same-sex sweetheart or not because of the passage of the DOMA, or the abolition of that Defense of Marriage Act. No matter who your partner is, whichever your sweetheart is, you don't have to have the same plan. A Medicare Advantage plan might work for you, but might not be efficient for your spouse. So, be aware of that. Just trying to think of some other caveats. The other thing is, you know, when you're a Medicare Advantage plan, you're going to have to have a referral, you're going to have to stay in the network, you might have something happening and you want to go to Dana-Farber in Boston, it may not be covered. You know, you may not, your request to seek that specialist might not be covered. If you decide to go to X hospital instead of Y, who is not in your network, you're not going to be covered. You know, so just kind of keep that in mind. So that, ladies and gentlemen, is pretty much it. I want to make you aware of one more item. If anybody is not comfortable going to the Medicare website to choose a Medicare D plan, if you fill out one of these, which is essentially, I don't need all your private business, just give me your name and a phone number. I don't want your Medicare number, I don't want your social security number, but if you have other preferences, like for which pharmacy you like, are you in Mass Health, blah, 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 and you list your prescription drugs, I'll run it through the formulary for you, and I'll give you a printout, okay? So just see me if you need that. And that's true for anybody at home watching. I'm happy to do that. That's what we do. These are your tax dollars at work. I work for the Council on Aging, so I'm paid to be here. Many Shine counselors do this on a volunteer basis. They are not paid to do what they do. They provide a huge service helping disseminate good information, good unbiased information. They're not paid, but the whole program and the training and, you know, the literature and so on, that's your tax dollars at work. You know, we're always riding in the state of Massachusetts, Taxachusetts, but here, actually, this is your tax dollars at work. Other states do not have this kind of information available to you. So do avail yourselves of it. It's good stuff. It'll save you money. And then for anybody whose income is under $1,900 a month, especially folks out at home paying attention to this, call me. You don't have to talk now, but there are ways to save money on prescription D coverage. It's called Extra Help. It's the low-income subsidy. It'll help cover your premium for Medicare D. It'll help you with co-pays. Talk to me about Mass Health. That is another opportunity to save money. That's what this is all about, you know, to save you money, because it's all pretty expensive. So, does anyone have any questions for me? Ma'am?
On the fitness coverage, is it $150?
It depends on the insurance company. The question was, you know, does gym coverage, fitness coverage, is that paid for through your health insurance plan? And some do offer that as a benefit.
Right.
You just have to check with your particular company to find out what it is. I think you're quite right, though. I think as a general rule, it's $150, and you have to actually go to the gym and receive a bill and pay your bill right through that time. Say it's $50 a month. You know, you have to actually go to and pay for, you know, the 3 months before they'll reimburse you. They won't do it up front, and then you go, oh, great, chips on the couch. Anyone else?
I have a question, but it's
After the fact? Great, we will talk. Well, thank you. Thank you for
Thank
coming.
you. Thank
I
you.
appreciate it.
Thank you.
And share this with friends.